Hey everyone. How's everyone doing tonight? I am doing great. Happy Friday. And we're going to talk about food sensitivity testing. I'll take these off. And tonight we're going to talk about food confusion because I think there's a lot of that in this group. And we're going to talk about how you ended up with food sensitivities and gluten sensitivities and how that all kind of came about. We're also going to look at the difference between allergies, celiac, and sensitivities, because there is a difference, and there's a difference physiologically, and there's a difference in how you need to handle those things. And then we're going to talk about the tests for a few minutes, and I've got a special offer for you at the end. So 10 minutes on and off, right? I am going to watch my watch, and we're going to get started. So, of course, there's a lot of confusion about food. You can read, eat this, don't eat this, eat peppers, don't drink coffee, don't eat peppers, do drink coffee. Like, what are you supposed to believe? The one thing that we do know about Hashimoto's and most autoimmune disorders, if you have one, you potentially have others. And what we do know, thousands of studies have shown that there is a strong correlation between the gluten that we get here in this country and damage to the intestinal tract and damage into your immune system. So we know there's a correlation. Go gluten-free, right? If you really need to know, do some sensitivity testing and find out. But I can almost tell you with certainty that there's going to be a gluten issue, and it will make you feel better once you come off of it. So that's why there's so much confusion about food, because do this, don't do this, do this, don't do this. But really, we can get down to exactly what you need to go off of. Should I eat dairy? Should I eat soy? Should I be consuming eggs? Don't really know until you take yourself off for an extended period of time, which is longer than 2 weeks. So let's get down to the point where you can actually figure out what's good for you and what's not good for you. We had a couple comments the other night that I did food sensitivity, it didn't work for me. So I'm going to tell you how we do it and how we walk you through it, because the key is to stay off of those foods for 90 days. Yeah, 90 days away from those foods, because that's how much time it takes for your immune system to chill out to those foods. It's the only way that you can really heal. Nobody wants to hear 90 days, but that's just the truth, right? So that hopefully that clears up a little bit of confusion about what to eat and what not to eat. We know gluten-free, we don't really know the rest until we start to test, right? We just don't know. I learned right before I had my daughter so many years ago that peanut butter, eggs, right, wheat, those were not gonna be my friends, and whey protein, which is part of milk. So, you know, boom, boom, there goes peanuts, there goes whey, or milk, there goes eggs, out. And no question, and wheat too. So just understand that it's not like I haven't been there, and it's not like I haven't been living in this world for a while. So hopefully we can clear up some of that confusion about food. How did you get this way? Well, I've talked endlessly, and there's lots of different references for leaky gut and how we end up with leaky gut. But I'm going to tell you that the standard American diet, right, the modern urban diet, or SAD MUD, is how we got here. That's how we got here. That combined with too much alcohol or caffeine and not enough water, not enough sleep, right? Not enough movement in your life, and way too much mental and emotional stress. So even just living in this country is mentally and emotionally stressful at this time. So if you think that that's not part of your world, think again, because all of those things play into our gut, right? Your gut and your gut thoughts or your intuition, right? All of this plays a role in how your immune system works. So this is how you got that way, right? Time over time, right? We all have a timeline. And that's how we end up getting sick, is by, we might have too many antibiotics as a kid, and then we end up with mono, or we have poor eating habits, maybe in college, maybe. We get pregnant and have a couple babies right on top of each other, and maybe we don't supplement properly, right? So those are the things that add up to the illnesses that we end up with today. And that's how you ended up with Hashimoto's. That is also why your gut is unhappy with a lot of the foods that you eat, or your brain is, because your gut and your brain are connected, right? So when you figure out what foods to eat, then your gut feels better and your brain feels better. All right? So that's how you ended up that way. Allergies, celiac, and sensitivity. Allergies first. You know the kids in your neighborhood or the person in your world that has an immediate reaction to peanuts or strawberries or eggs, right? Their throat closes up, their tongue swells up, they can't breathe. That's called anaphylaxis or anaphylactic shock. That's what comes along with an allergy. That is different than what we're talking about here. This is measured through something called, I was looking for my marker. This allergies are measured through IgE. This is immunoglobulin E. Immunoglobulin E. So that's what they measure for allergies. They can do skin testing. They can do it through blood. There's a lot of different things that your traditional allergist will look for in terms of allergies. This may or may not have anything to do with why you're confused about food, all right? You can get allergy tested all day long and take some of those foods out or have no results whatsoever. So be careful of when you say you were allergy tested, what were you tested for? We're going to talk, we're going to move into sensitivities, and then I'll come back around to celiac disease, because sensitivities test for immunoglobulin G, as in girl, immunoglobulin G. This is an immunoglobulin or immune protein that pops up on a delayed reaction. So these can pop up 48, 72 hours later. So it's very hard to track your food and figure out what you're sensitive to, because, I don't know, I can't really remember what I ate for breakfast today. How am I going to know what I ate 3 days ago and then correlate it to symptoms that happen someplace in between, right? It's very, very difficult. So, not that it can't be done, but it's difficult. So this is what we test for when we test for food sensitivities in the test that I'm going to talk about in just a minute. Celiac disease is actually another immune disorder that happens to the inside of your intestinal lining. And the intestines have lots of little fingers that increase surface area and absorption area. And when someone with celiac gets gluten, all of those little fingers start to die off. So they actually have an intestine that's smooth, and it's supposed to be more like a grassy field than a mowed off dirt field, right? It's supposed to have all these little fingers. And when people with celiac eat gluten, it changes their physiology and their structure of their actual intestinal lining. So this is a big deal. You cannot eat gluten if you have celiac disease. It will destroy your intestines and will leave you very malnourished. Sensitivities, on the other hand, create more leaky gut, which is different than losing the surface area. It creates little holes in between where more proteins get into your bloodstream and your immune system gets turned on. But that's a very different thing than celiac disease. So let's talk about the test. The test that we offer in our office is 96 or 184 foods. So those test for sensitivities, right? And we normally charge $700 and $800 for those tests, but for you guys, we've got them for $450 or $550. And Gina, one of your awesome functional medicine dietitians, she actually works for the Cleveland Clinic Functional Medicine, and she's on your group. She's one of your resources here, along with me. And she's willing to do a 1-hour consultation after you get your test results back to help you put this into play for your life. okay? So we're not gonna just give you your test results and say, good luck with that. We're here to help you implement this in your world. And so that's what we're here for today. That's what I wanted to give you. This is one of my first do-it-yourself functional medicine, DIY FM in 10. I'm Dr. Sargent. I hope you have a great weekend. Thanks. Take care. Bye.